morning. Good morning. Good morning to all of you. I hope you had your coffee and all of those good things. I don't necessarily get the privilege to do that because I'm not a coffee drinker, but I'm high on life, and I welcome you to District 2 and to this lovely facility here at the Luby Center and all of its history that it means to our area. This is an awesome thing, and awesome to have all of you are in your importance, and also on the health end and education end that we are here for today. I'm not going to get on your nerves or talk you to death, because us as my wife says, politicians talk a lot like preachers, but I'm both. But nevertheless, it is really good to see all of your smiling faces. I just wanted to introduce to you all of the great people that are behind me, and I see our Metro Schools Director that is out in front of us, and our health department guys, and all of you great people who helped to run this awesome Metro government. Without you, we could not do it. And with you, we're making the city what it needs to be. We also have Councilman Freddie O'Connell that is here, one of my partners in good things, not crime. But a lot of people, sometimes they may think that we're doing crime, but we make sure that we get things done for the city. But as we go along, we have our standing behind us. We have Senator Bill Frist, that is here with us, and very glad to have him. Just doing talking to him today about I was introduced to him years ago here at the Nashville City Club, and by someone that is not here with us anymore. But it is an honor to be here with him. We also have Dr. Bill Paul with the Metro Health Department. That is here with us today, and kudos, you do a fantastic job in our health department. We also have Dr. Frida Outlaw, who is here with us, and she said she's in disguise today. I know I've met her. I said, hey, I've met you several times, She said, you have, so she's Superwoman today, but I'm very, very glad to have you here. We also have Dr. Raquel Qualls Hampton, and very, very nice young lady. She greeted me with a smile this morning, not anger. So that is great stuff. But we're very glad to have her as well. And then we have Yuri Kunza that is here with us. I see him all the time, usually in our chambers or somewhere around and all of that good stuff, but I'm very glad to have him here, especially representing the Hispanic chamber or the groups of the Hispanic community that is here in Davidson County, Nashville. And then we have Caroline Young that is here with us as well. Caroline is the Executive Director of Nashville Health. And Nashville Health, the Executive Director, is a very important job because we're in the midst of an area that's here in Davidson County, which is the part of 37208. Coming out of there, we have a lot of health issues, disparities. We have a lot of kids who are dying, who are just being born. But we thank all of you very, very much for being here in District 2. But again, as I go forward, I'm going to get out of your way to introduce my friend, individual who is in front of leading our city into an awesome place. The person that we worked with as the vice mayor of the city, and who is now leading the city as the mayor, Mayor David Briley. Why don't you put your hands together and give him a big round of applause. Thank you.
I was afraid I was in for something there. Turned out okay. Turned out okay. Well, good morning, everybody. I feel obligated a little bit before I get into my prepared remarks to comment on the name of the library where we are. It's named after Z. Alexander Luby, who was a lawyer in Nashville back in the 50s and 60s, and certainly no other name stands out as much as his does in terms of fighting for civil rights in our community. And so I think it's apropos that we are here today to talk about what is essentially a new civil rights struggle. So if you look at our community in particular and look at measures of health, you can associate poor health with zip codes. And zip codes are generally correlated with race as well in our community still. So we acknowledge here that a new civil rights struggle in our community is to provide more opportunities for healthy living and better health for all parts of our community. So so it's great to be here today. To kick off the Nashville Community Health and Wellbeing Survey. It's the first time in about 20 years that our city is going to look comprehensively, objectively at the health of the city. And it's important that we have that kind of data so that we can go out as a community and make the changes necessary to change the health trajectory of our community overall. Dr. Sean Joseph from Metro Nashville Public Schools is here today, and he knows as much as anybody that if we want our children to succeed academically and socially, they're going to have to be healthy. And that is such an important priority for this community. They're all sort of interwoven to a great degree. Councilman Freddie O'Connell, my councilman, is here, and I want to thank him for his leadership on the city council. I don't see Kent Oliver, who is the director of the Metro Nashville Library, so I can say with impunity that Monique Odom, the director of my favorite department, the Parks Department, is here as well. Just recently, we opened the new tennis facility at Hadley Park, which is an important part of making sure that that part of our city has more opportunities to live in a healthy way. So she's a great partner in this as well. Let me wrap this up by saying that as long as I'm mayor, we're going to work harder to focus on data, because we know that with better data, we can change the way we design our city. And a lot of the problems we have in our community are around design. How have we decided we are going to live? Those decisions are within our power to change. And we've made a commitment to putting more sidewalks in. I know it sounds simple, but just getting people out of their cars and walking to and from one place is important. Now, if you don't have a grocery store in your neighborhood to walk to, that's a problem. So we got to be more focused on those kind of things. Nashville has no better partner in this. Nashville has no better partner in this than Senator Bill Frist. Behind the scenes, every single day, he is focusing all of the efforts of this community to focus us on these important issues for the city of Nashville. I'm convinced that by the time I'm done as mayor, we can say with certainty that no longer is your zip code going to be the determining factor in terms of how long you are likely to live in this community. And I am committed to working with Senator Bill Frist on that effort each and every day so that we can accomplish those goals in the very near future. Thank you. And So, with that, I hope you'll give a warm welcome to my friend and to one of Nashville's great stars, Senator Bill Frist.
Thank you. Thank you so much. Thank you, Mr. Mayor, and it's an honor for Nashville Health and all of the various organizations that are represented in this room to be working with the mayor and the Metro Public Health Department. And just looking around the room today and listening to the mayor, it really reestablishes in my mind the importance and real value of what we represent today, and that is collaboration. Coming together to get the best, to get the very best out of the many organizations, nonprofit, for-profit, business, government, academic, all aligned directly around better health of our civilians, of our residents, all of whom live in the borders of Davidson County and metropolitan Nashville. And not just there, but indeed around all of Middle Tennessee and around Tennessee because of the impact that we can have. Collaboration. Nashville Health, the organization that is I'm representing and partnering with, is founded on that collaborative approach, the aim that business and government and nonprofits and citizens can all work together to lift everybody up, regardless of where they live, in terms of health. And by health, it's not just disease, free of disease, but overall well-being. The effort today really points to the fact that this survey will provide data that does not exist today. If you're a physician, you have to be able to make a diagnosis before you can actually treat and get people better. And today, we don't have the data. We don't have the information. The mayor just said we want to be data-driven. We need to be data-driven to get the foundation, to get the diagnosis so that we can know where to intervene in a collaborative way to lift people up to better well-being. And it's really no more complicated than that. As the mayor said, it has never, he said 20 years because that was the last more comprehensive survey, but it has never really been a survey like this in terms of reaching out with this numbers, not just in sample data that can be modeled, but actual data. The real voices, the real narrative coming from individuals and individual families. When we launched Nashville Health now about 3 years ago, we quickly realized that we really did lack that data to truly diagnose where our community well-being and health levels are. We had no measure to track if we did intervene with all the many programs that are going on, whether or not we were getting really better or getting worse. And if you can't measure that, you don't know how to go to scale. You don't know where to put more resources. And that's what this survey is all about. Working closely, intimately with the Metro Public Health Department and the nationally recognized University of Illinois at Chicago, who are experts, the experts in the country in this sort of analysis and community-driven gathering of data. We now have a truly collaborative, comprehensive, real-time approach to diagnosing the health and well-being of Nashvillians. We'll have the foundation upon which we can build. Survey results will provide, for the first time, valuable detail about health-related behaviors, about the chronic health decisions which we know bring down the health of overall Nashvillians, of the preventive health practices, what we should be doing. You know, what are our values today in terms of preventive health, and how our local environment and where we live, the structures that are there, the transportation that's available, the access to that healthy grocery store and healthy foods and parks and sidewalks. It'll be for the first time that we have that data. It will also play an important role in setting future priorities. Where do we go? Where do we want to be in 2 years or 4 years or 7 years? The digestion of this data, the analysis of the data, will be able to answer those questions. And we aren't going to stop here. Future surveys, and maybe every 2 years, maybe every 3 years, we don't really know at this point, we'll be able to measure that change over time. Involvement, there are so many people here today and stakeholders here and others who have supported this initiative, which is this collaboration, this coming together. It's not just Nashville Health. It's not just the city. It's not just the Metro Public Health Department. Involvement and support, I want to thank several of these groups, AmeriGroup, the Memorial Foundation, United Healthcare, AmSurge, Nashville Area Chamber of Commerce, Change Healthcare, Vanderbilt University Medical Center, the Healing Trust, Live Nation, and Vector Management. All of those people, many other partners, but all of those have invested directly the resources to make this survey possible. Your support, the people I named, everybody representing so many organizations in this room, your support is vital to build a healthier future for our city. Now I'd like to turn it over to my very good friend and colleague, Dr. Bill Paul of the Metro Public Health Department. Dr. Paul.
Good morning, everyone. Bottom line, it's time for Nashville's checkup. The Nashville Community Health and Wellbeing Survey could be in your mailbox, and it could be coming soon. So if you receive one, please take the time to open it up and take the time to respond. Your input can help make Nashville a healthier place. Just as a doctor needs to know the patient's vital signs, we need to take the temperature of Nashville's health every so often. There are many ways we do this, many data sources that give us valuable insights, from information about births and deaths to this census data to health care data to various surveys. We also, just like you want your doctor to listen to you, part of getting data is really listening to Nashville. Where does it hurt, Nashville? What are you ready to work on as far as your health? So that's part of what we do looking at data. Well, this year, the Healthy Nashville Leadership Council is doing its community health assessment. This is a joint effort. All of our hospital systems are involved in this, our community health centers, and of course the health department. And the Nashville Community Health and Wellbeing Survey is a part of that. It will provide us really important information for the assessment, help us understand and prioritize what will improve our community's health. The community assessment will in turn inform the Community Health Improvement Plan, which is Nashville's strategic plan for improving health and well-being for the next 3 years. Health is really what happens before you get sick. We tend to think about health as hospitals and doctors in white coats. Well, the Nashville Community Health and Wellbeing Survey is about helping us size up the key elements of health in our population, how people feel, key characteristics about their health, like smoking, like exercise, like mental health. And it's important that we reach people whether or not they're engaged in medical care, so that we can understand the key health issues for people in Nashville, whether or not they go to a doctor. Now, historically, there's a CDC survey that does a lot of this. And it's given us estimates to measure up how Nashville's doing, track ourselves over time. But now that most people are using cell phones and most people are screening their calls, the response to telephone surveys has gotten really challenging. And so the people who answer a survey on the phone now can be very different from the people who live in Nashville. And so we do the best we can, but now is the time for something new, and that's why we're talking about the Nashville Community Health and Wellbeing Survey, and we're really excited to be launching it today. This is really a true community effort, with the health department and Nashville Health in the lead, a really strong cadre of funding organizations, and really a good, solid community conversation to pick the most important questions to ask. The survey is being done differently than past surveys. It's not telephone. It's, you'll get a letter in your mailbox. The letter will have this symbol on it. If you get one of these letters, please open it, and there will be instructions on how you can take the survey. So, Nashville, it's time for our checkup. The Nashville Community Health and Wellbeing Survey could be in your mailbox soon. If you receive one, please be sure to open it and take the time to respond. Your input can help Nashville become a healthier place. Thank you. I'm going to do it in Spanish, just real quick.
Okay, let's hear it.
The survey is offered in English and Spanish. It will give people the opportunity to answer the questions on the web, so they'll be able to go to the internet and do it. Not everybody in Nashville will get it. 11,000 people in Nashville will have a chance to participate, and we really hope that every one of those people pays attention and takes the time to fill out. Llegó el momento de hacerle la revisión de salud a Nashville. La encuesta Community Health and Wellbeing Survey podría llegar en su buzón pronto. Si usted recibe la encuesta, por favor asegúrese de abrirla y tomar el tiempo para responder. Su aporte podría ayudar a Nashville a ser un lugar más saludable. Gracias.
Just wanted to say again, thank you for visiting and coming to District 2. Come back again. We appreciate all of you. God bless you and have a good day.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.